Hello, I'm Dr. Karen Bierman, and I'm a clinical psychologist. I have offices in San Antonio and Bulverde, Texas, and thank you for having me today as part of today's program. My first segment, I'm going to speak about chronic pain and how psychologists can help people cope with chronic pain. And just a little bit of background as far as the mind-body connection. The basic theory or facts with the mind-body connection are that how we're thinking and feeling emotionally affects how we're feeling physically. For example, if you have chronic pain, you're likely to get depressed about your chronic pain because you don't feel good and you're not able to do the things that you used to be able to do. And likewise, if you don't feel good emotionally, if you're depressed, then you might end up having physical complaints, and physical pain related to your depression. So with that preface, that's kind of the background as far as how psychology can help with chronic pain. I see about maybe a quarter to a half of my practice is chronic pain referrals, and people have been, to see pain management specialists and, have tried everything or on narcotics or pumps, but looking for alternatives. And the first thing, that's important for managing chronic pain is stress management. And of course, that's important for all of us, but the higher your stress levels are, the more likely you're going to have physical complaints, and it'll contribute to chronic pain. So, living a more balanced lifestyle and having proper diet, getting enough sleep, taking up yoga, or some kind of meditation, some kind of relaxation training. I also specifically teach progressive muscle relaxation, which I'll talk a little bit more about today. And then I use cognitive behavioral therapy. That means I help people change their thoughts or cognitions, and then also help people change their behaviors and therefore change their lives. So if you can reframe how you're thinking about your stress or your chronic pain and look at it in a different way, and also change your behaviors, what you're doing to treat it, like getting massage, and the stress management, actual behaviors, or seeking out social support if you've become isolated. Those things certainly help managing chronic pain. One of the really big challenges with chronic pain is people often become disabled and are no longer able to work or work at the level that they used to, and then this results in financial difficulties, as well as not being part of an organized routine or having the social support that goes along with going to work every day and having your routine, having the co-workers and colleagues that you interact with. So this makes it even more debilitating, like it's not bad enough to already be in pain. And another aspect of chronic pain is that people usually look healthy on the outside. People can't see it because it's not so obvious. It could be related to an accident, and there could be injuries or surgeries related to it. But just having someone to validate, that chronic pain does exist, is kind of rare and certainly helps people with chronic pain. Other alternative treatments are biofeedback and muscle relaxation training, and also psychoeducational groups. I have led groups in the past for people with chronic pain so that they could get together and talk about some of their similar complaints and get some social support in that arena. And I cannot emphasize enough the importance of social support and avoiding isolation and having people to talk to about your issues, or or joining a health club, which exercise strategies have worked. Because the other part with exercise is important not to overdo it. I highly recommend stretching, but not in excess. For example, getting up in the morning and stretching, and then having, maybe throughout the day a few times for just, 10 or 15 minutes each time, and then also before going to bed. And then another piece of chronic pain is the impact on the family. For example, with parents, if they are diagnosed with chronic pain and they're no longer able to be as active as they used to with their children, that's certainly a debilitating effect on the family. And then the guilt that goes along with that. And what I want to leave with you is just a little bit about progressive muscle relaxation. I go through this exercise with people in my office, and then of course give them out the script, and then they can practice it at night, before going to bed, particularly if they're having trouble sleeping, and also just for pain reduction. And it's something that you can try any time of the day. And what you would do in the first session is just sit in a chair wherever you're comfortable and then systematically go through each muscle in the body from top to bottom, tensing and releasing the muscles. So for example, you could start with your right hand or forearm and you would tense and release, and then your left hand and forearm, and then the right upper arm, behind the arm, kind of, flex and show off your muscles, and then moving on down to the left hand and forearm, the left upper arm, and then going to the forehead, tensing and relaxing the facial muscles, raising your eyebrows, tensing your face and then relaxing your face, and the eyes and cheeks, squeezing the eyes and then relaxing, and the mouth and jaw, clenching your teeth and pulling the corners of your mouth back. And then with your shoulders and neck, you might need a little bit of pre-training, but you can lock your hands behind your neck and push back the head against resistance. Or you can pull your shoulders up and press your head back against their resistance, and then kind of let your shoulders hang and sag. And then with your chest and back, breathe in deeply and hold your breath, pressing the shoulders together. Deep breathing is actually very therapeutic, for both stress management and dealing with chronic pain. With your belly, tighten the abdominal muscles or draw in the belly, and then relax. And then, going through the whole body, down to the legs, with your thighs, and then moving down to your calves and your feet. Crook your toes and release. And then the left side, shovel your left foot forward, and then the left hand calf, lift up the heel, and the left foot, crook the toes, and then you're done. And it's very helpful to do this either in a psychologist's office, or you can get the script and then read it to yourself, or put it on a tape recorder and then play it, before you go to bed. Or you could have a family member read it out loud to you. And there are also there's also guided imagery and other ways to look at pain, like you could perceive it as burning, and just kind of focus on the sensation, and then it will start to disappear. I know people have also tried hypnosis, with varying effectiveness for dealing with chronic pain. But the bottom line is figuring out what works for you. I mean, some people having a weekly massage makes all the difference in the world. For some people, a massage is painful. Swimming is good, it's low impact. Water aerobics, in the heated pools, but then you don't want to get overheated, if that's not comfortable for you. So just the take-home message is there's a lot of alternatives for chronic pain, and you are not alone. I hope that this is helpful for those of you that suffer from chronic pain.